presented in this video is not intended to diagnose, treat, cure, or prevent any disease and has not been evaluated by the FDA. Please consult your physician before starting any medical regimen. Oh yes, my friends, we have another exclusive interview for you today. One that you will need to share to the four corners of the earth, because we're going to be asking questions and bringing you information that the mainstream media is absolutely ignoring. An emergency doctor blasting Bill Gates, the fake pandemic numbers, now in question as the economy collapses. Rashid Buttar, he graduated from Washington University with a double major in biology and theology before attending medical school at the University of Osteopathic Medicine and Health Sciences College of Medicine and Surgery. He trained in general surgery and emergency medicine and served as brigade surgeon and director of emergency medicine while serving in the U.S. Army. He is a board-certified clinical metal toxicology and preventative medicine. He is board eligible in emergency medicine and has achieved fellowship status in 3 separate medical societies. Today, he serves as the medical director for the Centers for Advanced Medicine with clinics in California and North Carolina. These clinics specialize in the needs of patients with immune dysfunctions and toxicity issues, usually manifesting in various conditions such as cancer, heart disease, and autism. And for over 20 years, he has been ranked as one of the top 50 doctors in the United States. His first book, The 9 Steps to Keep the Doctor Away, became a Wall Street Journal, USA Today, and Amazon bestseller, and is now an international best-selling book translated into multiple languages. Now this week, a video he made called out the fraud that is being perpetuated across the world by the World Health Organization, the CDC, Bill Gates, the deep state, the mainstream media. It went viral with millions of views worldwide. Doctor, welcome to the program.
Thank you, Gary. Appreciate it.
Now, 3 weeks ago, you called this a conspiracy. You called out the hysteria being perpetuated to scare the world population based on false data. Now, it was Jerome Adams this week, the Surgeon General, and the Trump administration who agreed with you when they announced that they had dropped the World Health Organization and the CDC model and are now working with real numbers. Okay, this is directly from the White House. This is the Office of the Press Secretary. Now, Tuesday, the White House putting out this press release demanding accountability from the World Health Organization and committed to investigating the response, the false claims, and the cover-up. So explain to our viewers what led you to this discovery and how the numbers never supported their claims.
Well, Gary, basically, I have patients from all over the world, and patients were concerned about this, and they asked, and I put out in social media that, look, if you really want to know, I'll make a video about this. And I expected some people to respond. I had, 700-800 responses. Just yes, please get us the information. So I asked the question because you're hearing stuff about conspiracy. So those videos that we put out were actually asking the question, COVID-19 conspiracy ? And as I started looking at it, to me, it just didn't make any sense anyway. We deal with the hardest to deal with medical conditions anyway, so it wasn't a big deal. I just remembered that when I heard about the coronavirus aspect, there was one particular component that we used intravenously a lot in our clinic, and I just made sure that we had 10 times the normal amount, and that was it. It wasn't a big deal. It didn't bother me. However, as I started looking at this information, as I started seeing that this is actually a chimeric version, something that was developed here in the United States in 2015, was published in Nature magazine, that it was developed in the University of North Carolina, Chapel Hill, where all the initial studies were done. The chimeric research, despite having a moratorium by the U.S. government to prevent any chimeric research, by the way, just so your audience understands, chimeric research basically means that they're taking a naturally occurring substance or virus, in this case, and then mutating it, genetically modifying it, changing the configuration morphologically to gain function. It's called a gain of function study or gain of function research. And that basically means that they're making something that already may have some potential to cause harm, making it more harmful, making it more virulent, making it more resistant. And basically that's what I found, that they took the SHC014 strain of the coronavirus, the surface antigen component, and brought in the backbone from the SARS coronavirus, put them together, and then inserted HIV and MERS orthologs on top of it to make a more virulent, more detrimental virus. Now, the thing is that
if I could jump in for just a moment here, because what I think you're talking about is the moratorium that was placed, and then $3.7 million from the National Institute of Health was transferred to China so they could continue this research, even though the moratorium. So they basically outsourced this research to China. Is this the same topic we're talking about here? This news is just breaking?
Yes, this is exactly right. So it goes back to 2014. The U.S. government decided, based upon certain virologists at that time, saying that, look, there's no justification for this kind of research. There's a potential for it to cause harm, cause a pandemic. So there's no justification for us to do this type of research. So the government passed a moratorium in 2014. Fauci approved budgets to be monies to be section for this type of research. So basically, and I'm getting really, every time I think about this, it gets me really flustered because I'm so angry that he basically broke the law. He more than broke the law. He created this entire cascade that we're seeing with the world shutdown was created by this initial aspect back in 2015. He broke the law. He went against government moratoriums. He took taxpayer money and he funded research that has now led to the COVID-19. In 2017, he was documented at Georgetown University saying that there will be a pandemic that this presidency will face, that this term will face. How did he know that in 2017 that something was going to happen in 2018, 19, or 2020? You can't predict the market from 3 days from today, what's going to happen. How did he know that there was going to be a pandemic? He stated the president of this president will face a pandemic. The exact quotes, I don't want to say the exact words. You guys have the video footage. My point is that when somebody starts making these type of statements, and then they were involved with the breaking of the law to fund the research that American taxpayers paid for, that then goes to Wuhan and now trying to create this diversion and say that it was China. God, I don't know whether it came from China or released in China, whether it was already released here. It's irrelevant. The complicity of what's going on right now, whether it was released in China or whether it was already here or however it happened, the U.S. system has condoned it, has jumped on it. They're opportunistic. They're shutting down the economy when they know, in fact, that there's no basis. I mean, there's no virus that leaves 6 feet or 12 feet. Now they're saying 13 feet. Complete misinformation. And I'm sorry that you've pulled the chain on me right now, but the mainstream media, when the Surgeon General came out and said that basically the Gates model, the Fauci model, the World Health Organization model was not going to be followed anymore, and they were going to look at the actual data, the actual number, the mainstream media didn't respond at all. All they said was, it seems like we're going to be going to 2022 before people can assemble together. That's what ABC put out. And Fox, or was it New York Post put out, it seems like that the 6 feet of social distancing is not going to be sufficient. It needs to go to 13 feet. There's no virus, bacteria that jumps 13 feet. It defies every logical aspect of science and medicine. And what really, really pisses me off is that there are thousands, tens of thousands of doctors and scientists out there that know that this is a fraud, and they're not saying anything. Either one, they're scared of social ostracization because they're going to be called out, or social shaming, or they're afraid that they're going to lose their license. For God's sake, this is changing the planet, and every scientist and every doctor that knows this to be a facade needs to open their mouth and speak. There is every aspect of science has just been literally picked up, thrown in the toilet, and flushed down. It's like everybody's ignoring it. The fundamental aspects of how the human system works is being ignored. Physiology is being just put in the garbage bin. Every aspect of virology and infectious disease is being ignored. Koch's postulate has been ignored. Every aspect. Then we've got false positives coming from testing that we know is not adequate, and then the testing that they are doing, like the RT-PCR, the real-time polymerase chain reaction testing, that's already been shown. It was actually the guy who developed it in the 1980s, Mullis, said that you cannot use this